This video will be about explanation of ECT to a patient who tried more than 2 different antidepressants without any benefits so far. With trying the first choice of the treating team, patients are usually hopeful, but after failure of the first choice and also failure of the second choice, and when we come as doctors to inform the patient about the third treatment he needs to try, his expectations from that treatment should be lesser than what he had when he was prescribed the first or the second antidepressant. We need to consider that while talking to him. Besides, keeping some effective treatments like ECT as a last resort. This is because presence of some precautions and some sophisticated practicalities that should be considered while providing any patient with this type of treatment. And dispensing hope in such a frustrated patient is a cornerstone of encouraging him to listen to you. So my advice in a station like this is to start with the patient, telling him, "Hello, Mr. Franklin. Thank you for coming to meet me today. I understand that you have been suffering from a depressive episode over the last few months, and you have tried more than one antidepressant, but none of them helped you to recover from your depressive illness. But I have a good news for you, that the most effective treatment for depression you didn't try yet, and we are thinking to provide you with this treatment. I mean electroconvulsive therapy. Have you ever heard about it?" Expect that the patient will tell you something negative about ECT. For example, that he came across information about the memory problem that ECT can cause for patients who are receiving it. And I prefer not to start your talk about ECT with talking about its negative aspects. I mean its side effects. Although you can do it, but you can do something better. To tell him, "I appreciate your worries regarding memory problems that could be caused by using ECT. But I'd like at first to give you a hint about the effectiveness of ECT and some about its practicalities, if you don't mind." Usually he will agree to listen to you. Here you can start with telling him how effective ECT is. And when you come to describe how it could be applied to him, just try to prescribe the steps will be done to provide him with ECT in the form of care that will be provided by multidisciplinary team. You can start with doing something. At first, we will check your physical health before each single ECT session, just to check that you are fine and you are able to receive it and your body is fine. On the day of the session of ECT, we'll come to a special room with full equipments that will be needed during providing you the ECT session. And all the time you will be accompanied by well-trained and experienced nurse staff, and the doctor of anesthesia will come and provide you with something to relax your muscles and to give you something to make you sleep during the session. And a piece of rubber will be put in your mouth just to maintain safety of your teeth, tongue, and lips. Then a well-adjusted and safe electrical current, it will cross your brain tissue, and this will happen over a minute. Then you will be transferred to another area to recover from anesthesia, and there you will be accompanied by nurse staff, and after regaining your consciousness, they will check that you are fine, and once they found that you are fully alert and you can go home, they will let you go. And they give him a chance for 2 or 3 seconds just to understand the information you provided him with and to see if there is any concerns about what you have told him. If he asked you about the side effects, or if he remind you with the memory problems, you can address that at that time. Tell him, "Thank you for asking about side effects of ECT," and return back to your concern, I mean memory problems that could be caused by using ECT. Yes, it can happen. In vast majority of cases, those effects in memory are of short term, and after some time, your memory condition can return to its usual. But if we found that there is long-lasting difficulties to your memory, in this case, instead of applying the electrical current to the 2 halves of the brain, we can apply it one of the 2 halves, and this practice is known to lessen the effects of ECT on the memory. And in the middle of the station, you might need to think out loud. I mean to tell him that your duty is not to push him toward a specific decision regarding accepting or refusing ECT, but your main role is to inform him about different aspects of ECT and to provide him with clear, correct, and essential information that can help him to take the right decision regarding receiving ECT as an effective treatment for his depressive illness. And thank you.
you.